Hey guys, so the episode's about to start, but I wanted to give you a heads up. The audio we had a few technical difficulties with, and so it's not quite up to par with some of the other episodes. But I think the content from the guests that we had on is pretty valuable, and so I didn't want to scrap the episode, but I did want to give you a heads up. Bear with us. Cue the music. Hello, everyone, and welcome back to another episode of the Core Consult RX podcast. My name is Mike Corvino. With me, as always, my good buddy, Cole Swanson. And we're joined by two very special guests once again. We've had multiple guests in a row.
Yeah.
It's good. We're just
Multiple two for guests. Couples.
two, yes.
Yeah. This is great.
So, introductions, guys. Tell us who you are. What are you guys?
You want me to go first?
What are you guys about?
Sure. So I'm a fourth-year pharmacy student, currently enjoying my little break of 2 months off before I start rotations. And what else would you like to know?
What's your name?
Oh, I'm Swathi. It's a good idea. I guess I can give you a little background. I'm originally from New Jersey, and I went to college at Carleton College in Northfield, Minnesota. Woo. And then wanted to change, so I moved down here.
Okay.
Awesome. Yeah.
Very cool.
Big change from Minnesota down to South Carolina.
Definitely.
Yeah.
What did you do undergrad down here too, or
No, I did undergrad in Minnesota.
in Minnesota? Gotcha. Very cool. How you liking MUSC then in the South Carolina life?
It's just like a very different vibe.
Yeah.
Yeah, I've definitely enjoyed it, but it's just really interesting to compare and contrast like different parts of the
So
country.
is this your fourth South Carolina summer, or have you had more than that?
So this is actually my first because I've either been out of town or I've done my
really?
rotations out of town.
How do you like it?
It's really hot.
Lots of sweating?
Lots of sweating, lots of indoor time.
Mm-hmm.
Yeah.
Yes.
Pretty much between noon and like 6:30, you can't go outside.
Yeah.
Yep.
Or
Between
you might
5
pass out.
a.m. and 9 p.m.
If the sun's up, you don't go
Do
outside.
not go outside. It's too hot. Beju, what's up, man?
Hey, what's up,
We
guys?
finally got you on the podcast.
Finally got me on there. Yeah,
We've been
fair
talking
enough.
about this since like episode 2.
Yep.
Well, thanks for having me. Really excited to be here. By the way, what you guys are doing is just phenomenal. You're bringing attention to our world, which is pharmacy, and in a way that's just so authentic. So I'm learning a lot from you guys. I'm trying to figure out, as far as how does a pharmacist become a pioneer of their field. One of my roles has been be part of sort of this innovation team at the Medical University of South Carolina, and what I'm learning is we often have a great way to manage our patients, and we're really good at managing a lot of things in our practice, but we're so good at that sometimes that we kind of miss the picture, and we don't think what else can we do as far as outside of practice, and how can that then impact our patients, and sort of thinking outside the box, being a bit more creative. So I'm very enthused. It actually just came back from ASHP summer meeting
Awesome.
in this past month, and we had the very first pharmacist entrepreneur session, and there were actually a few entrepreneurs doing some great things, Sam Endereg and Nate Petey, that are creating some great solutions around of
Is it mostly technology-based stuff, or
mostly tech. So it's like either augmented or artificial intelligence, and also sort of machine learning kind of tools, and using those to kind of either integrate with our EHRs or with our other technologies out there to make the problems that we kind of come up day in day out kind of go away. So it's really just nice to see that they're solving problems leveraging technology in a very different way. So
do you have an example of what that might look like in the EHR?
Yeah. Well, so there's actually a few things we're doing at MUSC that I can kind of share a little bit about.
Sure.
And some of the things that we've been working on lately have been, definitely on one end pharmacy focused, and on other ends very non-pharmacy focused. But I'll jump to just maybe something we're working on right now. It's to do with drug shortages, and you guys have heard about this, you've seen this, day in day out, like we're getting hit hard.
Especially last year.
It's
really bad for that.
Isn't that crazy?
Yeah.
So what was it? What was the thing that sort of the main events that happened last year? I mean, there was this like Puerto Rico
hurricanes,
hurricane, right? So I didn't even know we had like almost 80 manufacturing sites.
I know. Nobody did until that hurricane.
Yeah. so we're out like what IV bags now. Or
Yeah.
Say a whole bunch of like common items that we normally carried.
Yep.
We're just like wiped clean. And so how do we mitigate some of these drug shortages? We'll have to defer to secondary suppliers, or we have to defer to higher cost sort of producers. And what we found is actually there's our expenses for the health system, especially, they're rising like exponentially because of these impacts. And then there's also this smoke and mirrors, right, from the pharma industry. This pricing sort of adjustments being made. So one of the things we've created using this technology of machine learning is a dashboard tool that sort of looks at drug cost for our health system, and then allows us to, first of all, standardize the price of drugs or formulary that we need to buy from the list they supplies, and then also active surveillance, so looking at drugs on a daily basis and monitoring, seeing if they actually spike up in price or if they kind of bottom down, and maybe we can find some predictive forecasting models around that. But really, on the surface level, just saving on the price of a drug at any given time.
Yeah.
So yeah, it's pretty cool. We're actually piloting it this week. We're on the second week of our pilot.
Awesome.
And we're looking to save hopefully several hundreds, if not a few $1 million of drug costs.
Really?
Yeah. So
That's
it's gonna
impressive.
be a good adventure. But again, this is going back to this is something a pharmacist, as well as partnering with technology and a programmer or developer, can really do in a much more powerful way, because we understand the context, we understand the level of complexity in our systems, and so that's the value we as pharmacists can provide to this new sort of era.
Yeah. So if you guys didn't notice, we're talking about innovation today. A lot of that is in the form of technology. And I think especially in the medical world and even pharmacy, when people think of innovation and technology, they think of robots taking our jobs or taking technicians' jobs, and they get a little uneasy about it. But you just demonstrated it's not really the case, and it's focused elsewhere, right?
Yeah, literally giving us better tools to do a better job, essentially. So yeah.
Yeah.
And I think Swati's sort of noticed a little bit of that too, just from joining us on some of our journeys towards innovation. So maybe you can sort of jump into that at some point later. I don't know if
Yeah, sure. Mm-hmm.
Absolutely. Sure.
Yeah, and I think too what's kind of interesting is people, like Cole was saying, get a little bit worried about technology taking jobs and this, that, and the other, where other people who have that kind of go-getter mentality don't look at that as an opportunity of like, oh shoot, this is going to take my job away, I'm not going to be able to do this. They look at it as an opportunity for themselves to grow, switch to a different role, and adapt, which is what you have to do to survive. I mean, when people had bookstores and they had other, they talk about the
when
truck,
they had bookstores.
I mean, like when
there's
that
no
was
bookstores
that was a
anymore.
very prevalent thing. Amazon wiped most of them out. I feel like that's safe to say. But they talk about like truck drivers, like that job eventually going away. Like everybody immediately freaks out with the technology. I think it's interesting to see the two different mindsets of an opportunity versus just the impending doom.
Right, because you have the go-getters, like you said, but then you have others who aren't necessarily worried about it taking their job, but they have been doing the same thing for 20 years, and if this is going to be something else that they have to learn or get used to, that makes them nervous. Even if it's meant to help them, they don't always see it that way. It's just an extra thing they have to do and to learn.
Yeah.
Yeah, it's a good point, actually. You know what? Really thinking about there's a risk to everything, right? Like there's a risk to having your fixed income job, or there's risk to the entrepreneur sort of journey, right? There's always going to be risk. It really is dependent on what is your purpose, and then also finding folks that are in line with your purpose. I think is being key. So I just wanted to sort of mention, as you go through this journey, while you're a student, while you're a clinician, I feel like I'm always a student anyway of life, and it goes back to your growth mindset, sort of point. While you're going through these journeys, I think it's also important to just recognize that there are folks that have gone through the journey, and finding these sort of peers or even mentors, I think is highly valuable. So definitely as part of my journey, Mike Capito, our CIO, Chief Information Officer at MUSC, has been our biggest sort of champion and mentors for spurring these types of thoughts, but also providing us time to work on these projects.
Yeah.
And so then paying it forward also, as practitioners, we should also pay that forward to students and make sure they have a way to sort of navigate these.
Yeah, it's great when you have an employer who promotes and facilitates those sorts of things, and
Exactly.
employees who want to get involved in that kind of stuff. And if you're a student, it's important to get involved too. I think Swathi can speak to something that she worked with, and I think it was Google, kind of promoting innovation within students, and they got together and worked on some projects. Can you speak a little bit about that?
Yeah, sure. Definitely. And then I actually wanted to mention something before that. So when you were talking about, paying it forward to students and everything, I was going to bring up the medical innovations group that was started on campus. And so that's just such a great opportunity. They bring entrepreneurs, whether they're, clinicians on campus or they're just in the community, because the Charleston startup community is kind of booming at the moment. So we just bring in those people and they get to talk about their journey and field any questions. It's just like a very lax atmosphere in the innovation station.
Awesome.
There's actually going to be one on Thursday, right?
Yeah.
You want to talk a little bit about
okay.
that guy?
Is that cool? Is that,
Yeah,
can
of
we
course.
do a
Absolutely.
Talk about
selfish
whatever you want, man.
promotion here?
We are all about plugs. So
Talk
go ahead.
about whatever you want.
So downtown Charleston at the Medical University, Thursday at 4:30 p.m. We're gonna have our next meetup, and it's MUSC's Innovators Meetup. Basically, it brings in startups, entrepreneurs from our Charleston community to interact with our clinicians, our students, our faculty, and our innovators within MUSC, and just have this conversation. So it's like really just getting together in a safe, supportive environment, and whatever happens, that's purely secondary and outcome to like just engaging the community. So to Shwati's point, like we've had some great we've actually had some great outcomes. One of the things I think at our very first meetup, actually we got to meet with a startup, and you actually worked with them. So maybe you could maybe talk about that just briefly, because I thought that was pretty cool.
Yeah, sure. So lots of awesome things have come out of that, like just inspired students, and I'm sure clinicians the same, me being one of them, definitely. So towards the beginning, we had this like very cool pitch competition that MUSC hosted, and so that got startup companies from all over the state to come. And I was really, really intrigued by one of the companies in particular. They were trying to create this neurofeedback system using an app to try to help, I'm not like cure obviously, but to like to like kind of, I don't know what exact like word to use, but to try to help the treatment of ADHD and substance abuse. And my previous research is in substance abuse, so that was like something I very much want to get into. And so I started working with them, and so we had meetings like once a week, and we'd meet with the two guys that started. So they were both serial entrepreneurs. Actually, one of them went to USC and studied business there, and the other studied psychology, and so they kind of joined forces. And they both already had successful companies before, so they had learned from their previous experience and brought that to the table. And then also there was, I think he was a master's student from College of Charleston, and he was working on some computer science stuff, and so he was helping with the prototype, but they were also planning to kind of outsource the prototyping to Launchpad, right? Yeah, and so pretty much we'd meet every week and talk about how the progress and project and everything was going, and there was also a marketing chick on the team, and so she did a lot of that as well, and so I helped her with that. And then one of the main things I did is I served as a like kind of a liaison between MUSC and all the opportunities that are, at MUSC and the startup itself. And so I know that they were looking into opportunities for starting clinical trials, especially when they got the prototype together. And so I was helping them create relationships in between. And then also, like, I'm really interested in brand management, so I got to work with the marketing side as well. And
Awesome.
so it was a really great experience, and I would have never learned about that at all if I didn't go to these meetups or obviously know Beiju or anything like that.
Yeah. Do you know how it went? Are they in clinical trials? Is it, you followed it well?
So as far as, do you know the update as far as?
Well, they did get funding.
They did
They
get
got funding
funding.
for
They
it.
had funding from SCRA, which
Yeah.
I believe was the first seed, which was $200,000.
Awesome.
So the seed money, but it was good because it was really a great, had a great pitch, and they scored. But I think to Swati's point, what your role, I think, was you're really the subject matter expert in healthcare. If you notice, like a lot of these startups, they don't really have the healthcare expertise. So it's where, like, we come in as clinicians. This is how we add value, and it's even more powerful if you can innovate from within as well, because now you're in the front of the problem, you're very close to the problem, and you have the skill sets to solve the problem. I mean, that's just immeasurable in my opinion. So, yeah.
Absolutely.
And
Good
it was
point.
actually like really fascinating to go through and see what is going on in neurofeedback right now. And so whether that was through searching on PubMed, or that was, searching the media and seeing what's going on. So like comparing like market research versus like with what is actually happening in like the medical field, that combination was really, really cool.
So how does that look in one of those patients? What are they doing to help with their ADHD? Is this to help them not to remember to take their medications? This is actually some sort of treatment through the app, right?
So right now, I can give you a little brief overview. I'm totally not an expert.
No,
but,
And there's probably trade secrets involved. I don't know.
no,
Just
definitely not.
kidding.
I just mean biofeedback and everything, neurofeedback right now. The way that it works is like for it to be effective, it's been proven that you have to go to a clinician's office, and first of all, the clinician has to be certified, and there's only I think it's like a double-digit number of clinicians that are certified in the U.S. So it's really hard to find someone. And then on top of that, you need to go in 3 to 4 times a week for 3 to 4 hour sessions. So no one really has time feasibly to do that to get the results that they need. And so this was a way to streamline the process and bring the care into the patient's into their perspective, but also their control.
Yeah.
And so if they had that app, they would be able to kind of have their own sessions on their own time.
Interesting.
That's pretty cool. So, Swati, I got a question then, because you mentioned you really like brand development and all that. So this is something, and I haven't really talked about this much since in the podcast, probably since episode 5. So I'm going to bring it up again. But
Every 20 episodes.
every 20
you can
episodes, I'm
bring
going
it
to bring it up and talk about it. So my philosophy of the last 15 months or so has been, I think that with the way healthcare is going, with the way social media is going, I think that basically you're going to have these healthcare professionals that are clinicians that have this very, very micro celebrity type status on social media and things like that, so that much like some of these entrepreneurs now that are starting to have this almost like they're sports or rock stars or sports players. I've mentioned Gary Vaynerchuk on the podcast before, but he has his own sneaker now with K-Swiss. He's an entrepreneur. It's bizarre stuff like that, but that would never have happened before. I kind of see that going in the same direction with healthcare professionals, to where they'll want a certain pharmacist or a certain PA or a certain physician to come to that institution to teach, because they know that their social media following is enormous, and they're going to have that many students follow them because they want to go to school with them.
Definitely.
And what are your thoughts on that? What do you see kind of branding, or personal branding in general with healthcare? Do you have any thoughts on that?
I think personal branding is really important. It's funny that you bring that up right now, because as of now, so I didn't talk about what I want to do in the future, but I would like to do something in marketing and brand management. And so I would like to do that through the focal point of hopefully getting an industry fellowship at mid-year. And so I've been talking to a lot of fellows recently, current fellows, past fellows, who have been involved in these commercial roles. And personal branding comes up so much, and how important it is now to market yourself in a certain way and the way you come off. And so I think that like not only using that in the career sphere, but also on social media is just, I think it's going to take off, and that's what's going to be next. I completely agree. Yeah.
Cool. We got one. We got one supporter.
Got one supporter.
One supporter. There goes all of our ratings on iTunes. Like, you brought it up again. What an idiot. No, that's cool. So Baiju, you know, one of the things that I really, really enjoy about like what you guys are doing with the innovation station and all that, and you know, unfortunately, I've only been able to come like one time. You guys really need to quit doing it on Thursday nights and do it on Tuesday nights so I can come hang out with you guys. You guys are killing me. But you know, it's just having that many people with diverse backgrounds, but being around like-minded people like that is really what pushes people who are go-getters to keep, you know, striving and keep trying to find that next, you know, mountain to climb, if you will. And it's one of the things I noticed. I was like, as I'm like walking around, like talking to people, I was like, wow, I need to go home right now and get back to work because I'm not doing stuff hard enough. And you know, just talking to how many people are doing such cool things, like it's such a good opportunity for people to meet and like be around that same vibe.
Yeah. No, I agree. I think one of the biggest pieces of this sort of meetups and these sort of building the community is diversity, right? So like it's definitely like-minded sort of folks, you know, that are encouraged and, you know, so sort of support each other. But it's also this factor of like, you know, you're gonna meet someone who doesn't think like you, doesn't look like you, doesn't even behave like you. You know, maybe from another industry completely, and that's where the power of this type of kind of community lies, is right. Like, you know, you can maybe meet a pharmacist and an engineer in one meetup, and you might come up with a brilliant idea. There's been some great automated devices that have been produced, born from that type of synergy, actually. So like, you know, thinking about even meeting students at these meetups, you know, some of my best sort of idea forming has come out of that. You know, you don't have to sort of I don't have to mention Swati again, but like, I mean, seriously, like there's so many ideas we've just sort of thrown at each other, I think, in the past even few weeks. And it's that sort of like awareness, and then of course, you know, you have to take some of these ideas and take action on them and sort of keep that momentum going, because I mean, ideas are just ideas, right? 99% of whatever we do is the work we put into it. So I'm not gonna go all Gary V on you, but I just want to say,
I wouldn't stop it.
Well, to quote, like, well, you know, something I've learned from him is, you know, I also like being the underdog, right? You know, it's not about the ego. It's not about what your role is. It's really about learning and making sure you do the best possible kind of work out of whatever you're doing. I mean, really, it's whether you're just, you know, staffing in a pharmacy to, you know, innovating in an academic medical center, to being an entrepreneur. I mean, really, it's just, you know, that's the constant journey we're all on. So yeah, I just love being in that community and being sort of within like-minded with like-minded mindsets, I guess, and being the underdog, because you know, you never know what's going to happen, right. and that's it, you know.
And that's the best part. Like when you combine entrepreneurship or you know, business development like that with the medical world, that's what, I mean, that's what I like so much about medicine, is you can play forever, because there's no way you'll ever know everything, and it's not like this game that you can just kind of get to the end. It's like, all right, well, now what? Like it just goes on and on and on. You get to play forever. That's like my favorite part of it. And
once you get to the end, you get to go back to the beginning where everything's different, and now you gotta relearn everything.
Or you just are too old and just call it a day.
All right, we're done.
Yeah, we tried. We played hard. No, I mean, I love it, because it's just it never gets stale. It's constantly changing. You got to constantly be evolving, and it just keeps going.
Yeah, agreed. No, that's totally it.
Yeah, and you mentioned everybody being like-minded and us being a community. One great thing about being in the healthcare field is that we all have an end goal, and that's patient care and good patient care. You mentioned a situation you had today where things can happen, a small thing that, you know, while it may be inconvenient for me, ultimately affects patients. Right. And that's what it's all about, preventing those types of things and providing highest quality patient care.
Yeah, no, I agree. Actually, it's funny. I sort of had a thought. Again, back to this profession we're in. We have such a great community. So we have, again, at ASHP summer meeting, and these work groups that I'm involved with informatics specifically. It just reminds you, like even though I work in technology or I I work in worlds outside of pharmacy, you kind of go back to these kind of spaces where, at heart, you're a pharmacist. And why you got into it is because you wanted to make a positive impact to other people's lives in a way where only healthcare professionals really know how, right?
Yeah.
And, some of the best sort of piece of advice I've gotten are from these sort of communities, and I call them my home community, right? And I think there's value in just sort of building that community up. So one of my recent passions, I think, has been, cultivating this awareness to other clinicians, especially pharmacists. There's technologies out there, but there's also this entrepreneurial mindset that I think can be highly valuable to. So, whether you're working in a unit or working sort of in the community pharmacy world, wherever you are, like you can make a change in the way you practice and change the process where it makes the entire system better for you as well as the patient. And that's where, going back to these sort of communities with our profession, I think there's a lot of value to be shared. I just think that big organizations are very slow moving.
Oh, yeah.
So
A lot of red tape.
right. So I mean, that's the nature of big organizations.
It's almost unbearable.
Yeah, right. So like to really disrupt an organization, it's actually it's tough, and sometimes you really can't. You have to like sort of go outside.
Right.
But I think the best disruption you can make is within yourself. Change your mindset, and then ultimately you can make a bigger impact in the world. So that's the message I want to share to the world.
There you go.
guys
There
are
it is,
doing
world. So one thing I'm always like kind of fascinated with, and Cole and I have talked about this just randomly, but one thing that's interesting is I feel like pharmacists, for whatever reason, are so slow to adopt a lot of the new technologies, especially when it comes to like things like branding. Like we were talking about the PAs, and I spend obviously a lot of time with PAs now since I teach, for PA school, and some friends and stuff like that are PAs. Cole's married to one, so almost married to one. So we, it's one of those things we have them around us a lot now, and they are on social media networking and promoting their profession in droves.
Yeah.
It is crazy.
Yeah.
And you put in things in the pharmacy world, and there's like 6 people.
The rise and see, it hasn't always been that way, because the rise in PAs seems to be similar to the rise of pharmacists in the early 2000s, because there was a big jump. Ooh, goodness, there was a
Einstein.
it was Einstein. We haven't even talked about Einstein yet.
We'll talk about them.
Okay, we'll talk about it later. But there was a big jump in pharmacists in the late 90s, early 2000s, up to like 2010. That's kind of what's happening with PAs now. And with the rise of social media right now, they happen to be all over, and they're doing a really good job promoting their profession. Yeah.
It's good. And what's crazy is people see, and I'm kind of veering back to social media just because we've spent a lot of time doing that, but I see things like people still talking about how students need to get rid of their social media. They need to stop having an Instagram before their residency starts. And I've said multiple times on multiple people's podcasts, that's the most ridiculous thing I've ever heard. Like, just stop posting crazy stuff on there, and be an adult for 5 seconds, and you'll be fine. My stuff's wide open, all my personal stuff. You don't see me doing nonsense on Facebook and putting it out there for the world to say. But I see these professions that are like taking advantage of it. I watched the other day, a ophthalmologist performing, I don't even know what the heck he was doing, something a lot crazier than I'll ever be able to do.
Cutting open somebody's
eye on Instagram Live, and I was just like, yep, this guy's got it. This guy knows what's up. And he's like promoting his clinic, and he had like 50 something thousand people following him. It was just crazy. I'm like, this guy gets it. Like, he's using the modern technology. And I've met because of like things like Instagram, and I just got back from Miami 2 weeks ago, being down there with a couple guys that I've met through Instagram, from RX Radio, and I had a guy from Pittsburgh that we met, a pharmacist up there, flew down to meet us, and the three of us worked on some projects. I mean, I would have never met those guys if I hadn't been for like social media. So the networking opportunities, kind of like you're saying, your community is enormous if you use some of these tools, and yet it's still looked at as like it's this, evil, horrible thing. He's always looking at his phone. He can't even enjoy the day around him. Like, no, he's networking. He's networking in real time.
Yeah, they say the healthcare world is small, and they especially say the pharmacy world is small, but it's a lot bigger once you branch out of your immediate community.
And even then, we met Brian Gilbert from over there in Kansas, and he was like, oh yeah, he knew like 6 people that we knew that had gone into us. It was like, oh geez,
yeah, that's a small world.
Still super small.
Yep.
So yeah, I don't know. Sorry, I didn't mean to get off on that tangent, but
No. I was gonna say, like, Mike, I follow you quite religiously now, which is kind of cool because you're like just down the road from me, right? But I was kind of curious. Like, you should definitely get Brian Fung, one of our pharmacists on YouTube, on this channel. It's like he's doing some great things on YouTube, and he's really just kind of doing sort of storytelling in a different way. And I think that's part of it, is like, forming this narrative where you tell a story, you engage with, a clinician, a peer, or you engage with like a patient in a level that we haven't done before. And I feel like you're right. Like there's power in that, and really we should be pushing the envelope in that respect. So, I'm very inspired by both of you guys, actually.
Yeah, we'll send him a application to be on the podcast. And we'll have him fill it out.
Grueling application process. Yeah, can I be on the podcast? Yeah, sure. What do you want to talk about? I don't know. Okay, cool, you're in.
We'll figure it out 5 minutes before.
One thing though, so you're talking about how social media is like so important to like PAs and like how they're really utilizing it. But the one thing I want to bring up is what I think of is like how the nursing profession completely changed. They are so good for advocating for their profession, but they did that prior to social media. So like, what are we missing?
Right. Yeah. So in a big part of that is how many nurses are there. There's an immense amount of nurses. And unfortunately, pharmacists will always be relatively small compared to something like that. But yeah, they were a massive advocacy force before social media, and now they own social media in other ways too.
I was going to say, yeah, now they're massive. We have a friend of ours, his handle on Instagram is the Fit Pharmacist, and Adam Martin is his real name, and he's got a friend.
Oh, he has a real name?
Yeah, he does actually. I didn't know until Miami. But his,
your name is in Core Consult? Oh man,
who knew? But his one of his friends owns the page Snarky Nurses, and they just do like memes and things like that. She's got 300,000 followers.
Yeah. It's like all nurses.
And
they eat it up.
I've never seen anything like it. It's crazy. Yeah. I'm like, well, look at my 6,000. Isn't that cool? That's cute. Yeah. Let's go home now.
Right.
Take my ball and go home.
but yeah, they're all over it.
Yeah, the nurses are very, very good at it.
Yeah.
I don't know. But you're right, though. What are we missing? Gotta step it up. Come on, pharmacy. But I think, honestly, you know what I've noticed about is I feel like as soon as we're willing to collaborate with and work interprofessionalism, that's when we start, because my Instagram stuff has actually started going up significantly from interacting with the PAs. I know a guy named Steven. His handle's Page the PA from Emory. Super nice guy, and lives in Atlanta, and he's promoted me significantly. And it was funny because I would try to get these PAs to follow me, and they were like, no, dude, you're a pill pusher, get out of here. And then the second he was like, no, this guy's cool, like all of them started following me. It's like they had to like give me the okay, and from then on out, now I've been interacting with some of them even asked me questions about antibiotics because they're on rounds, and we had a patient today, blah blah blah. I had to answer a question on Instagram like that to other PAs, and just it's interprofessionalism is I know MUSC is so big on that. It's a big factor on Instagram too. It turns out.
And another part of the collaboration is if you can show your worth to, say, a nurse, and they want more pharmacists involved in their care. Now you have nurses advocating for pharmacists, or if you're a PA and you collaborate and show how you can help out these other professions, and you're going to have them advocating for you as far as legislation goes, because nurses can get legislation pushed through, that's for sure. Pharmacists can, and it just takes a really long time. Yeah, that's one thing to consider.
Well, and I think having that respect, like it's everybody's so quick to be like, no, we're the best. No, we're the best. And like, if you just stop and realize, like, and appreciate someone's specialty, like, and it's easy for me because, like, my sister-in-law works in transplant as a nurse, so I see how hard they work. Like, I could never do her job. I would be fired in 5 seconds. And it's
My mom was a nurse for 10 years.
Yeah,
so I
Yeah.
totally
it's
And my sister's
hard-
a nurse, as long as we're throwing it out there.
It is a hard job. Beju, what nurses do you know?
I was born, so I guess ultimately, I guess
You
someone
met a
gave-
nurse at some point.
someone
in
them
life.
in my life.
First person to touch you was probably
Right, I know exactly.
Maybe.
Seriously, like-
So yeah, I mean, like having that appreciation and seeing like, it's like, oh well, the PAs only went to school for 2 years, and we go to school for 4. Like you don't understand how difficult their schooling is, and having an appreciation for the other professions
Right.
plays a big factor because you put that ego out of it, and it opens up a lot.
Which
of
doesn't take
doors.
anything away from the professions
exactly,
that are
no.
traditionally known to be, highfalutin, like doctors and whatnot.
Yeah,
but
no, of course.
we're trying to raise up the underdogs.
Well, and it's not even just raising. It's just like getting out of it. Like I see a lot of pharmacists that are like, no, we're the drug experts and we know everything about. It's like they let the ego start to creep in, and you gotta fight that because
Gotta get out of there.
Really gets into the way of your interprofessional networking, especially.
Let go your ego.
Like, go ego, man. It's not important. Nobody thinks you're fancy.
So does that mean you're coming on Thursday to our meetup? So that's like
I would. I
That's
have
perfect
to. I have to
timing.
work.
What time?
I have to work Thursday night because you have to schedule it every Thursday. I have to work every Thursday night because
Wow.
of the teaching at the school.
all right, fair
So,
enough. We'll
Tuesday.
we'll make a special
Thank
event
you.
just
Special
for your
Tuesday.
schedule,
And if we
so-
could be on the brochure too, that'd be great.
It'll just
All
be
right.
it'll just be you and
For
Beju.
sure.
Just
hanging
me
out.
and Beju hang out. That's fine. I'll be there. Let's go to that cool coffee shop.
So, well, interestingly enough, you're actually one of our guests on our meetup fireside chat actually a few months ago, and I don't know if I'll.
That was like almost a year ago, Beju.
Yeah, it's okay. It's been a few months, but
September.
Yeah, fair enough. But
going by fast.
well, I'm kind of hesitant to like send another invite for another fireside chat because I remember the last time you actually
First of all, they all cheered me on and they
cheered
told
you
me
on.
to do
All
it.
right. All right, tell the story then. Tell the story. Go on.
They said,
confused.
so Beju had told them that I had been formerly a professional MMA fighter. And so then they were all like, well, do a move on Beju.
I said yes, by the way, which
And
is
he
my
did-
first mistake.
He was like, all right, cool, let's do it. And
Might have been your last mistake.
well, yeah, right.
I let you down very gently. I just threw him over my hip.
Wait, you
and,
really did one.
It was
Yeah,
very
no, I
compassionate.
did one. And
Right.
I threw him hard, but I caught him and I laid him down nicely.
Yeah, I almost fell asleep after that.
I laid him down, nestled him into his bed. No, it was pretty funny. Well, one guy asked me a question. I forget his name. He asked me a question, and then someone was like, "Yeah, we got to see Beju get toned." And he's like, "Yeah, that's true. I don't worry about my question." He just like wanted us to say, "Man, these guys are really turning the backs on poor Beju."
Throwing him under the bus.
I don't know if it's good or bad, but everyone talks about that.
Really?
So it's still like the highlight of
That's
the
funny.
meetup. So
It was like,
Brand recognition. I
well, you
guess.
know what's funny
yeah,
is
that's true.
what's funny is my wife, because she's seen me fight in real life a lot, obviously for not like street
outside
fight. Yeah.
of MMA.
No, not outside of MMA. For money, in a professional setting. So when I set that up, she said before I even moved my hip, I knew it was coming. She was like, oh, there he goes. So it was
She knew it was all
She's
over.
like, yep, he's gonna hip toss him right there because she's seen me set it up a bunch. It was pretty funny.
Right.
But yeah, that was a good time. That was
was a good
like
time, yeah.
I still feel like I had no business sitting up there talking, but it was a cool opportunity to get to do it. I was like, I don't know what I'm gonna help you guys with. Everyone here's way out of my league, so I'm just gonna talk.
Yeah, actually, that's an important point. It's funny because I think they call this like imposter syndrome. I don't know if you've heard the term, but it's where like you don't think you're worthy enough because you haven't reached or attained a level that you shouldn't be in that role, that position, that sort of in our case the fireside chat. And when I sort of got out from sort of reading these articles about imposter syndrome is really it's perception. And I totally think you were right for that time because it's really the value you're pushing out around that time it was immeasurable. And just like talking to other clinicians, it's like they often think should I like speak up? I don't think I'm well qualified, or I don't think I'm an expert on this, sort of discussion. And what I find is like when they do, it just opens up this new sort of avenue of discussion or thought that wouldn't have come about. So like again, diversity equals innovation. That's exactly why I wanted you to be there, is because you're providing this like next level of diversity to fuel the next round of innovation or whatever, and since then, so it's been about a year, right? Since then, we've had like these amazing guests come on,
Just way better.
and way better. No, I was kidding. They didn't throw me. That's the key point
They
there.
probably didn't. That's true. I was forced.
But I mean, it's just continued on since then. The momentum's carried on. So I mean, I definitely have to thank you for part of that. So
that was super fun.
It was
I had a
awesome.
blast.
Yeah.
And now we can get better with the cameras and all that stuff. So if we ever do it again, we're ready.
Yeah.
Of course, you guys have it on Thursday, so I can never go. So it's fine. I'll just watch you from YouTube. So,
That's good, though.
Swati, tell us about the. You started to talk earlier about the business competition and stuff you were in.
Oh, yeah.
Can you tell us a little bit more about that, like
Sure.
the actual competition part?
Yeah, so this is a Google Startup Weekend, right? That you want to- Okay, so Google hosts various startup weekends around the country and around the world. And so what they do is they bring in this team, and the team kind of gives everyone a little spiel, and people come ready to pitch their ideas, like super primordial ideas. So about 20 people go to the front, they kind of give their 30-second pitch, and then the judges decide, okay, these are the 10 best ones, and we're going to let you guys just see what you can do for the whole weekend. And so it's about 72-hour process from the beginning to the end. And once those 10 are selected, you can join whatever team you want. And so there were projects from, like, there was one in healthcare. The one that I was on was local politics, which is phenomenal. There was a shopping app that ended up winning, and lots of feelings about that. But anyway, so yeah, so we just worked really well, and it actually feeds really well into this whole interprofessional discussion too, because even like interprofessional outside of the medical sphere, because I think the reason our team did so well is because we had someone interested in graphics. We had someone who was an app developer. We had someone who was an accountant into business, and then we all just kind of worked together so well. And we all honored each other's different expertise, and I definitely learned a lot about each one of those things as well, even just over a few days, just because I was able to have that opportunity. And so they did that in Charleston earlier that year too, so I think they're trying to do it 2 times in 2018. So
Awesome.
definitely keep a lookout. It's called Google Techstars Weekend, and you can just Google it and see when the next time they're coming to your city.
And it's for anybody, not just for students.
Yeah, oh, it's for everyone.
Awesome.
So some of the people in the room already had like successful companies, and they were coming back to try another idea. Actually, one of the girls, so the way I learned about it is she came to one of these like fireside chats on Thursday, and she kind of
on
was like,
Thursday.
oh, yep. She was kind of telling us like, okay, this is happening this weekend if you're interested. And the reason like she's so passionate about it and she got involved is because she went with her little idea, and now she has a full-fledged business with like 10 employees. And so like she's like living proof that it works.
Yeah.
And like if you have other people who believe in you as much as you believe in yourself, that you can do it. And so yeah, just like a really great experience. I like wish I was in town for the next time.
Yeah,
That
that's cool.
happens.
So if you're interested in innovation, technology, business,
And you
sounds
just like
pretty
want to
cool.
learn about other things.
Yeah.
Yeah.
Yeah, that's awesome.
Very cool.
And all of those things, even though we talk a lot about the different healthcare professionals, all of those things are involved in healthcare. Because what is a hospital ultimately? It's a business. What is, insurance? It's a business. So all of those things come into play.
Yeah. So what's the future look like going forward for you guys?
Yeah. What are the plans?
Well, so just to add to that, we do have a lot of new kind of initiatives coming out with innovation. Startup Weekend, of course, is one of them. We'll be actually posting our Charleston one coming up in the next few months, I think. If you follow us on MUFC Innovators, we'll post it there. But we'll be bringing some pharmacy students, but also some other students from medical students and some other students from the colleges to it. So MUFC is going to be a partner basically in it for this year,
That's awesome.
and I think that's going to be pretty.
Yeah, that's
awesome,
cool.
Right?
I don't know.
And then also in healthcare in general, I think there's going to be just a lot of movement into sort of the technology space. So you can kind of envision wearables, things like the Apple Watch, but all the way to, glucometers that sort of track patients when they're outside of hospitals,
Right.
In their home. Now we're going to be seeing some really great things come to fruition from getting that data, which is really where this all lies, by the way, is at the core. It's getting good data, getting that data back to the hands of clinicians to take care of patients. So MEOC is going to be opening up essentially their EHR in a way where it's, first of all, secure and controlled, but also in a way where that interchange or that sharing of data can occur. So one of the things we're moving towards is being compatible with Apple Health Kit. And so this concept of Smart on Fire, if you've heard of this technology, it really just is a way to open source innovation. And Apple Health Kit has started the sort of fueled the flames, so to speak, in that realm. So we'll be seeing a lot of innovation around of this. MEOC is going to get on board very soon. And so, we may be able to, hey, let's bring on an app developer, maybe a computer science kid from the College of Charleston to develop an app, maybe say on pharmacokinetics. And then let's see if we can inject that app or overlay it on top of our IT system. Things like that.
Yeah,
It's
that's
just
cool.
a little bit more transparent, a little bit more organic in nature than we have had in the past,
Right.
just because we've had proprietary systems in the past. And so
Yeah.
data hasn't been able to move as well as flow as well as it should for patient care. So there's a lot of cool things from the tech angle, from the community side of things. And then really just, going back to this attention economy, like, you're promoting a brand, you're promoting, clinicians as a forefront of this sort of digital landscape. What I want to do is maybe get some of our students involved with, let's start a YouTube channel. Let's start some podcasting perhaps. And so, I think these are some things, taking sort of lessons learned from you guys, I think this is something we need to work on.
And I think it'd be really cool if you approach the College of Pharmacy to see if you can make it like an elective credit or like a special project.
All right.
Because then I think that'll like incentivize students
Find the
more to do
ones that
something
want
like
to do that.
Yeah,
Okay.
definitely.
Heard it here first, folks.
I don't know of
I was
any.
gonna say, this is just happening, so I like it.
I don't know of any colleges of pharmacy that have Alexa flash briefings every single day. I can set that up for you in like
Alright.
10 minutes if you want.
Let's do it. All right.
And even video flash briefings, all that stuff is very easy. And it's literally, because I had this idea for PA school, but again, everything's so slow because you have to get permission
Get it approved
and all
and
this
all
and that. Which is why I'm glad to have the core console stuff, because then I can just like do it. But like with the PAs, I said, we should do something that's like from the classroom. And literally just have bits and pieces, because I record my own lectures for the PA students and put it on Blackboard. But I'm like, I'll start it off and like literally just take 5-minute sections of my own lecture and just put that as the flash briefing, so that students start to actually hear real classroom lectures before they ever even get here, like undergrad students, to promote. We're in the process of looking to see whether or not we can use the name and all that stuff. But it's one of those things that like I just don't understand why people don't take advantage. There's so many opportunities, and that's nothing like that would take 5 seconds to set up.
Yeah.
Yeah.
And yeah, it's crazy. So yeah, 100%, go for it.
Cool.
All right.
That would be really cool.
Okay.
Awesome.
Well, and they even have the fourth years. One of the things I'm supposed to grade on is how innovative you are. Yeah.
Yeah.
Oh yeah.
Come up with
Oh,
those
in our
things.
eval.
Yeah.
Okay.
So and everyone, that's one of the things the preceptors say, that it's like the hardest. The hardest thing to actually kind of like, how are you supposed to be innovative?
Yeah.
I'm like, well, there's lots of ways to be innovative.
Yeah.
And so I think it's one of those things that, to get the students thinking that way. And I know like Dr. Christy Britton was good about that with the P1s when she took over that class.
Definitely.
Because I know I helped her out a little bit with that, like being one of the people that they could shadow and stuff, and showing just the different things you can do as a pharmacist is super important, because it is not just
Yeah. Yeah.
two jobs available.
Yeah.
It is infinite.
I know. I really think we have some innovative faculty,
Oh, yeah.
and really just pharmacists in our field, it's really just figuring out how to do that in a focused and collaborative way. I think is key. But we just had a conversation with Dean Hall at the College of Pharmacy, and he's just absolutely thrilled.
That's awesome.
He
seems very interested.
Yeah.
I was talking to him at the like preceptor dinner thing they had, the casino night thing, and which was awesome, by the way. And
missed out on it.
sorry. And I was telling him that I started using Snapchat to put like daily Netflix questions on, and he was like super. He's like, "Oh, that's a great idea." He's like all excited. And I was like, "All right, that's pretty cool." And the university's like excited that I'm using Snapchat for students. So it was cool that he got excited about that.
Right. Well, and the fact is, you didn't really come up to him with an idea. You actually said you're taking action on this, and I think that's key. Is like, just do it. Like the first point of any of this really is just starting somewhere and doing it. And actually, a piece of advice from one of my mentors, Mike, was just do it. See where it goes. How are you gonna know where the success is unless you do it, right? So
I'm a big fan of that philosophy. I don't think more than 5 seconds on it. Let's go.
Yeah.
Meeting? No, I'm not coming.
You're a big Nike guy. Just do it.
Yeah, I can't stand it. That's how we've run the podcast since day one.
Is that what
I was like, no, we're just going to do that. I don't care. Let's go.
Nice.
See what happens. If it crashes and burns, don't do it again next time. And it's been fine so far.
So speaking of which, I was talking to Shwati about what she's doing at one of our free medical clinics.
Yes,
And-
tell us about that.
And I was just like, it's astounded. So because you just did it. So
Yeah,
just
I've,
did it. Yeah,
I've heard
that's what I
bits.
mean.
I've heard bits and pieces. Fill us in. That's
Yeah,
awesome.
definitely. So I heard about it's called the Shifa Clinic in Mount Pleasant, and I'd heard about it, and so I was like, okay, I have to check this place out. So I went with one of my classmates just to see what it's all about, and I wanted to meet with the coordinator. And it is literally a place like I've never been ever before. I was telling you about this. I feel like they look at the patient holistically, which I feel like they don't really do anymore. Now, I don't want to generalize, but you know what I mean.
Yeah.
And so they're willing to spend as long as they possibly need with every patient. They offer everything from like family med to peds to OB. They bring someone like an optometrist in every so often to do eye exams for mainly diabetic patients. And then on top of that, they have someone who, a lot of the diabetes educators are really, really good with all their nutrition knowledge. So after that, they have their little bit. And then after that, they go to the back and there's a food pantry because they work with the Low Country Food Bank. And so they
Awesome.
can get all that knowledge and then literally go get the food
Yeah.
and leave, which
that's
is
cool.
amazing. And then they also have a clothing closet. So you can go also as a patient and take whatever you need. So it's just looking at the patient as a person, which I feel like is lost a lot of the time. And so after I found that out, so they have a physician dispensing pharmacy. And so they were really interested when I said, like, is there any way MUSC could get involved? And so we set up a program. I ended up working with Dr. Sterrett.
Okay.
And we set up a program where we sent P2s one afternoon a month about, so like the fourth Monday or something. And they went and did MedRex. And then the third years were in charge of the diabetes education program. And so we would go and talk to all the diabetes patients. But it was really great. So speaking about the EHR and everything that you brought up and having it be more delocalized, I guess, we were able to access all of their charts prior so we could work up all the patients, and me and the other students that were going before. It was great to just discuss that, and then we were able to talk to Dr. Sayre and kind of relay our ideas and ask him any questions. And then it was just one-on-one, us with the patient, and like we were able to do everything that you would want to do that you've learned in like an OSCE or an OSCE, and you could actually do it because you had the time.
Yeah.
And you got to do like the actual foot exams, which like hadn't done that since like one
Right.
OSCE. So like that was a really, really great experience to like know how to actually do that, to get really good experience on how to actually talk about nutrition, because I think that's just so important to diabetes and everything, and we just don't have a lot of practice in that. And then personally for me, most of their patients speak Spanish and I speak Spanish.
Oh, do you?
So I was looking for an outlet. I thought moving to the South meant that I would speak a lot more Spanish, and that's absolutely inaccurate in Charleston for some reason.
If you go to like 15 minutes to North Charleston.
I think
Right.
that's the issue. I need to like
my,
leave the
my wife's
peninsula.
my wife's pharmacy has a lot of people that speak Spanish, and she does not. So she's like constantly needing help.
And so, like, in college, I worked as a translator, kind of like on the side, like in a clinic.
Oh,
and so I was
wow.
looking for something like that. And so I was not able to use my Spanish until I was able to do this program.
That's
Yeah,
really cool.
That's awesome. Wow.
Yeah, so it's been a really incredible experience, and we're having one of my, I guess, like peers who was in charge of the second year program, she's going to move on and be in charge of the P3 program next year and manage all those students and everything. And then we just had interviews for the P1s that were interested in running it next year. We had 10 applications. Like like everyone has so much passion, so much excitement, like about Amateur. I was like very, very overwhelming. It was so
That's
awesome.
Awesome.
Yeah, so we end up picking 2 people, and we're going and doing an orientation at the end of the month and getting them like all acclimated to the atmosphere and like meeting the staff and everything. But I just really hope it's sustainable and I can come back in like 5 years and see that like the program is expanded. And this is something Beju and I were talking about is it's like so great that this clinic exists, but obviously there are other places out there like it. We just don't know it yet. And so I would love to come back in 5 years and see more clinics get involved, because as of now, the College of Pharmacy only has that one program like that. I mean, there's CARES, of course, but CARES is totally more focused on the med students, in my opinion. And so, like, this is really, like, for pharmacy. And they really do look to the pharmacy students for the knowledge. They trust us. Yeah, it's just, like, a very great learning experience, and I just think it benefits everyone. Benefits the students, of course, the patients, as well as the staff there.
Cool.
That's awesome.
It's a really cool thing.
Where's the clinic at?
It's in Mount Pleasant.
Okay. Yeah, well, if you ever need Cole and I to come hang out with you guys, we'll pick a night and come
Happy
out there.
to.
That'd be awesome.
Yeah, that'd be great.
Yeah, I'll definitely put you in touch with the people who are going to run it this year.
Cool. For
Yeah,
sure.
that'd
That'd
be
be
so
awesome.
cool.
Go out there, say what's up. Dr. Stare, I'll tell you what.
He's all over the place,
I hope
man.
he's listening, because he's like one of my oldest mentors. You know, he's been a huge advocate for me since day one. But he has got his hands in. He's going for legacy. He's not playing around. He is
Yeah.
he is taking.
I was working the
names.
other day and I got a call from a pharmacy student working at Vetter Clinic, and I said, "Who's your preceptor?" I said, "Dr. Sterrett." So there you go.
He's killing it.
Yeah, killing it.
18 clinics a day, I think.
Yeah, basically.
Basically, we need to get him on here. Talk
Yeah.
about this stuff. Yeah, he's doing big things. Telehealth, all kinds of cool stuff.
Yeah.
We'll get him on here soon.
And we actually, so I did a project with him that we're writing the manuscript. So I actually just talked to him earlier today too.
Nice.
And so we were looking at survey data, and so we gave surveys to all the third years right before finals, for them to fill out like 10 questions about how they feel, like how they perceive their preparedness for APPs. And so that's another thing he's involved in, is like helping students like get involved with research and really tabulate the data and help us write the paper. So that's like pretty much what we're in the midst of right now, is he's going through and making edits and we're going back and forth and everything.
Awesome.
So it's just like a, super comprehensive learning experience.
That's
Yeah,
very cool.
It's great.
Yeah, I've had one thing published since I graduated like 3 years ago, and it was because he wanted me, he asked me to jump on a paper with him, and so yeah. He's got me the job with my diabetes education. Yeah, he's helped me out quite a bit since I graduated. So he's a good guy. We'll get him on the podcast.
We'll get him on.
Definitely.
He's trying to avoid us because he's too busy, but I don't care. We'll go to his office. There's 2 of
We'll
us.
bring the equipment down there.
That would be a good idea. We finally get all of them.
We'll be the traveling podcast.
That'd be cool. We can do that.
Cool.
So,
Got anything else?
what else, guys? Anything else going on? Beju, you can go forever.
I know we can for sure. The one thing I guess, I wanted to leave you guys with is, really what you talked about with sort of research and staying in front of the community, sort of providing value. One area I think that, I'm sure there's a lot of folks already doing this, but there's a lot of folks that I've noticed that aren't, is really looking at treating patients, going back to treating the patients using data and becoming almost like data scientists. Like, I think there's a huge niche and huge area opportunity for pharmacists, emerging and senior alike, where we have an opportunity to transform the way we sort of practice, just by knowing how to use data in a way where we can make those transformations occur. So like whether it's using data to tell a story, data to show results, data to provide outcomes, evidence-based medicine, all of this stuff. It goes on and on, but I really think this is where we have landed ourselves in the 21st century, is like really moving towards this era of like technology and data to drive the next stage of patient care. So I would love to get more folks involved in this area. And one of the things I think we're gonna have to chat to with the colleges, let's get an elective on board. Let's get started for sure. But I think also let's connect with other pharmacy entrepreneurs and pharmacy innovators hopefully around the country, and let's collaborate in a way, where we form a community to solve some of these biggest problems.
So one of the things when you were talking, I just thought of, Dr. Hall, of course, super interested in innovation and everything. So he wanted to provide the students with more opportunities. And so one of the things he started this year was a class focused simply on like getting into industry, about the industry, various functional areas, everything. And so what if we use like his pilot idea of that course where he brought in a bunch of speakers, there was like an online portion, and we used that for the pharmacy entrepreneurship course as an elective or something like that. I think that formula would work really well.
Let's not rework the wheel, right?
Yeah, exactly. The wheel's already there, and it's good. So you just I like the thinking.
He's a true entrepreneur in heart, by the way. That's awesome.
Awesome.
Yeah.
An inception of great ideas happening on Core Console Podcast.
Whew, you heard it here, folks. That's awesome. Well, thank you guys so much for taking the time to hang out with us. Absolutely, anytime. We'll do it again tomorrow, whatever.
Yeah.
Why not?
So yeah, we really appreciate it. We'll definitely, if Beiju can ever switch the days to Tuesday, we'll come and visit and.
We'll do one.
Yeah, there you go. One day sounds good. So real quick before we go, for those of you watching the video,
I did want to mention him.
yeah, I figured you did. Yeah. This is our Einstein. He just points to his head like he's thinking.
He's our new mini mascot. I don't think he's going to take the place of T-Rex or RX.
He's definitely not.
No, and he doesn't have a cool name.
He doesn't. We'll think, oh, it's Einstein. I can't change his name.
E equals RX squared.
Oh boy.
Uh-oh. That's what happens when we do it on the spot.
We talked about this.
I like that.
We do not make up nicknames on the air. But yeah, I saw him at the Science Museum when I was in Miami with RX Radio and the Fifth Pharmacist, and literally couldn't get the money out of my pocket fast enough. So this guy's coming home with me.
Oh my.
Yeah.
He'll be around.
Oh yeah, right. Dead center
Always
camera.
thinking.
And I guarantee somebody didn't mention him. People were just like, oh boy. They got another dumb thing that doesn't make any sense in the podcast. Love it. All right. Thank you guys so much for listening. If you have any questions, you know where to reach us, any of the social media platforms. And thank you guys, as always, for the support. Thank you for the question, or for the comments and likes and all that stuff that you guys give us. Let us know if we can cover any topics that you want. And we will see you next time. Later.